Hello, everyone. This is Christy Bird McKeeve. I'm the CEO of Healthy Rural California, and also Executive Director of Butte-Glenn Medical Society and North Valley Medical Association. Happy to be here. Today is July 20th, and I haven't recorded one of these things or sent a lot of emails with updates just because the pace of things has been really fast lately. And so it's July 20th, and tonight at 6, I'm going to be speaking on the Doctor is In radio show. Thanks to Dr. Logan, who invited me to speak. I was at Chico Rotary at the noon Rotary Club Tuesday, and what a great conversation. I had spoken to the Sunrise Chico Rotary in June, thanks to Dr. Lane for inviting me to that. And I just had such a, great response from those two presentations. The community really understands that, what we're building just with the psychiatry and family medicine residency programs is about 5 million a year, up to 6 million in terms of annual revenue that is new and new jobs here in Chico. And so for Butte County, I think that's a big step. I've been leading my presentations with the question of when was the last time a new industry that was, going to be bringing that amount of revenue to the area had been launched. Some folks have said build.com, but for the most part, it's kind of a good thing for economic development reasons, but even more in terms of bringing hope of more doctors. I've gotten a little bit better in my presentations. Anyway, this was our latest magazine. I hope you have a copy of it. It says Hope on the cover, although it's in reverse in this image. But basically, by not having a medical education pathway for those who are on their journey to becoming a doctor, the region has really suffered from access to care issues. And so we're very, very excited about the work that we're doing to establish graduate medical education and those residency programs, to bring 2 regional campuses, one with Touro University College of Osteopathic Medicine and one with UC Davis in 2025. That from that, we hope that a medical school could also be in the long distance, looking forward. So the regional campuses would hopefully go into effect in 2025, and then a full complement of residency programs in Chico by 2030. So psychiatry is first, family medicine. We just got our application in last week. Kudos to the team for making that happen. It's a tough ask when people aren't familiar with what it's like to teach residents and how is it going to work. But you have to get through accreditation, and then those details can happen. Next steps for the application process is to schedule a site visit with ACGME's Family Medicine Review Committee. They actually meet more times than psychiatry. So we believe that we are on track to sort of have that site visit done in September or October, so that we are on the November 15th review committee agenda. And then the final decision about accreditation would be in early 2024. It's actually a very similar time frame for the psychiatry residency. So we're very familiar with that, very comfortable with it. And hopefully we can get a site visit scheduled prior to November 15th. Before November 1st would be great, but there's a little bit of room if we could get the site visit done by November 8th, even at the latest, we'll still be in good shape. But in all of that, again, we are partnered with Enloe Medical Center. And so for family medicine, the first residents would start in 2025. Well, that triggers their 5-year cap. And so we've partnered with them and gotten a sponsorship from Partnership Health Plans so that Enloe can have a feasibility evaluation of all things GME that they would like to embark on. Internal medicine, maybe, general surgery, maybe, some other things, and whatever, you can have as many new residency programs going forevermore, but the CMS reimbursement cap has to be achieved in 5 years' time. So we're really looking at potentially 52 residents by the year 2030. Healthy Rural California is the sponsoring institution, and that would be 8 to 9 million a year. So very exciting stuff. And then the regional medical schools. So just focused on medical students once a month for psychiatry, it is the most effective way to recruit into residency programs. And also, so we're not only bringing graduate medical education to the region, but we're also bringing medical student rotations, and really enjoying that, because students from medical schools across the country are excited to hear about us, to join us. So right now, we have Kruti Merchant. She is with Kansas State University. Oh, Kansas City University, I believe. In early July, we had Nicole DeAngeli from UN Las Vegas. So that was cool too. I enjoyed meeting Nicole because she and her husband are currently living in Sacramento and are interested, say, in living in Quincy. It's a beautiful, like, wow, how cool would that be to have a psychiatrist in Quincy? And that's where they want to be. So they're finding us. Vinny Alluri from Touro University in Middletown, New York, will be joining us for the month of August. In September, we have Ulas Deshpande from California CUSM in Colton. So that's a new one for me. California University of Science and Medicine. Jennifer Lay from Western University in Pomona. Megan McInnes in Missouri, coming from Missouri in October. So our goal right now is medical students who are year 3 or 4 and interested in the psychiatry. So they're rotating through psychiatry faculties, their clinics, and getting to know us, and we're getting to know them. So it's also training us. We have VSLO, which is the software needed to get students to apply, and then we arrange for their rotations. We expect to open up our family medicine medical student rotations in January. And so the family medicine faculty will be gathering for the first time July 27th. We're going to have an open house here in our office in Chico at 1905 Notre Dame Boulevard. And very excited about that. We want to thank the faculty for agreeing to teach residents in the future. This was absolutely necessary in order to achieve accreditation. People had to sign program letters of agreement, which they'd never maybe done before. And so it's just a huge thank you, but also to start coalescing that faculty. So even if they may be in different departments at the hospital, or they're in different clinical facilities, because we will be having the continuity clinics, both at Enloe Medical Center's primary care clinic and at Northern Valley Indian Health. So they'll be split 2 by 2. So the faculty need to have some cohesion just as much as we want the residents themselves to be a cohesive cohort. So it's really just exciting. We went down this path. We thought, who the heck is gonna want to apply? And to just, again, tell the community, there are people who are really, really interested. This morning, we met with Northern Valley Indian Health's board, and just so many exciting possibilities. I don't even have the words to describe, because we're just exploring how much more of a partnership we can have with Northern Valley Indian Health. I would tell you that the name, when we say it, when it's shown in a video, these prospective medical students and residents are very, very interested. They're interested in Enloe Medical Center. They're interested in this region. They're interested in getting to know the different populations in the region. So it's just exciting. It's like we got accredited for the psychiatry residency in February, and it was like a big shout out to the world. Hey, we're legit. I want to remind folks, though, that for the psychiatry residency, we will be participating in the MRNP process. I think that's what it is. The ARAS application system opens mid-September, and we are asking all applicants to go through that. And then we will be working through the selection committee with the final selection of our first cohort on match day, March 15th, 2024. So join us for that. It's going to be a great celebration, our very first cohort. Super excited. That in that we expect about 400 to 600 applications, and so it's going to be a lot of work to be fair and mindful of really selecting the cohort that's going to be the strongest with us. And we have to go stick through that process. It's a commitment that we've made. Our staff is not prepared to do one-off applications, and we mean that. And our staff is also not prepared to accept IMG applicants at this time. We have heard from many who have found us through the ACGME accreditation announcements. We sympathize. We are trying our best to start off this first cohort, just focused on what our staff can handle. And we are not prepared to take IMG applicants. So I just need to say that it's not for, anything else other than it's just a decision that we made together as a team for this first cohort. Talking to our friends at like Shasta Community Health Center in Reading, they don't take IMG as well. We're sort of similar to teaching health centers, even though we don't have a clinic yet for Healthy Rural California. And so it's kind of that model of, what can our staff handle and not handle. So huge shout out to Dr. Kumar and Casey from the Shasta Regional Medical Center. They just started their internal medicine, a brand new residency there. Really had a great time meeting them. And the other day, getting a tour of the Rural Sim Center here with Betsy Volker, who's our partner and friend. So some really exciting stuff happening. On the July 27th open house, please join us. We are going to unveil some architectural renderings of what we would like to build here in Miriam Park in Chico. I'm calling it the Rural Health Innovation Campus now, because when we talk about the regional campuses with medical students coming for their entire third year, 12 months, 6 rotations, and about 20 students every single year, they're going to need things like some housing. They're going to need classroom space, meeting space. The graduate medical education, the residents are going to need didactics, classroom learning space. And we would need a big conference center that can hold a lot of people, providing continuing medical education and other learning opportunities, an innovation lab, as we start to lift up the hood of what it takes to apply for an internal medicine residency and a potential surgery residency. Research is a big part of that. So there is research here in Chico. We're right next door to Chico State. We're excited about exploring what types of research our residents might be interested in pursuing and working with faculty from Chico State. For example, the public health department, data sciences, there's a big emphasis on the climate and the environment. Well, what does that mean for social determinants of health and how health outcomes could be improved by improving the environment, that kind of thing. We have, of course, patient safety and QI are big with internal medicine for research. But what about getting a biotech company and biomarkers for Alzheimer's disease, cardiovascular disease, cancer, endocrinology? It turns out general surgery research tends to focus on the liver quite a bit. So, and then of course, health science management, the Masters of Public Health that we would love to see at Chico State, all sorts of great research potential. And we'll be exploring more of that. But when you think about a campus and building out that innovation space, what more could we do? What more simulation can we do? And can't wait to share some of these architectural renderings, just that will give a look to what we envision as a campus, and what clinical opportunities can we add to that mix. Our architects are North Star Engineering, and shout out to Sean and Ty. They've been wonderful. They have such great experiences that they're bringing to this project. So if you've been to Miriam Park recently, the area that we're looking at, and hopefully asking Enlo for the deed to that land or part of it, you're coming in from Northern Valley Indian Health is on one corner. There's an empty lot, and then next to that is the new Enlo Cancer Center that's being built. And so that kind of creates this amazing framework for a medical education campus, an interprofessional healthcare learning campus. And it's enough space for our needs. And so it's just been fun to imagine what that could be. The Mechoopda Tribe headquarters building is also sort of right there as well. Just exploring some exciting possibilities about a tribal medical school eventually down the line. Those are just beginning. There's a whole bunch of talk at the state level. There's support from Physicians for a Healthy California on building this tribal medical school here in Chico. So we're gaining momentum on a bunch of fronts. And we have been in touch with SURF and the North State Planning and Sierra Club, I think Sierra Foundation, who are leading our region's SURF initiatives. When you talk about healthcare workforce education, there is a very loud voice, which is the community colleges, and they are essential. They are the voice of, hey, high school students and others, get your AA degree, or, there's different certificates that are viable for healthcare workers in a variety of different settings. And that's a very, very important voice. But when you're talking about healthcare workforce, the bachelor's and beyond, and even the faculty first messaging really needs to be strengthened in this region. First of all, medical education does not currently exist in Chico. And that is, you have to get a bachelor's degree. You have to get your MD or DO, and you usually have to get your residency done in order to become a doctor. And that whole piece of it has been missing. You can't get your pre-med degree at Chico State, but for the most part, you have to leave the region in order to become a doctor. And so we're really working hard to change that. And also to, reassure everybody that leaving a little bit of clinic, you don't have to leave it entirely, but to teach that next generation is really, really important. Both faculty and preceptors to teach residents and medical students. We're encouraging you all. We got to do this. We got to roll up our sleeves, because the medical education pathway must be built. And it's a change, but we have some great people doing great things here in healthcare, and we know that you can teach that next generation of medical students. And then for nurses, we hope to do some fundraising to get the money to help balance out that a nurse leaving the clinic is going to probably lose about 50% of our income. So how can we do a faculty first campaign that kind of balances that out a little bit better. So speaking of fundraising, I have some ideas. I'm going to do a sponsor a medical student, it's $500. Sponsor a resident, $1,000. We are doing golf for more docs. I know you're going to hear a lot of this and you're going to laugh, but we're having fun with it. Golf for more docs is going to be April 15th, 2024. It'll be our first one. And that's going to be at Canyon Oaks Country Club. And so it's $125 per player, $500 per team. And what a fun day it's going to be. Bridget's really gotten this together. Something about a cannonball, a ball cannon, sorry, where you can shoot your ball further at the first green, I think, whatever it's called. I like playing golf. I'm not really good at it. We have golf sponsorships available, which is a great way to get your organization's name out in front of physicians and the community. Everybody's welcome to play in the tournament. We're going to do a dine for more docs. I know you're going to get tired of me saying it, but this is really going to be our theme for a long time to come. So save that date for December 5th, 2023, 5:30 p.m. We'll be at Butte Creek Country Club, and it's $150 per person, $250 per couple, and $1,000 for a table of 8. We really look to celebrate all of the faculty who have agreed to participate in the psychiatry and family medicine residency programs. We want to thank them. We want to celebrate them. They're really being leaders in this effort. And so we want to make sure that they are appreciated. Bridget's making it semi-formal, so it's going to be fun. And again, it is still a fundraiser so that Healthy Rural California and Butte-Glenn Medical Society can function as we build out these programs. I have so much more that I want to do for the fundraising, reaching out to North Valley Community Foundation to talk about planned giving. We think that that's another great way for sustainable funding for our organization. And what these dollars will do is discretionary funding that we don't currently have. We are at this point 100% grant funded, which is very specific to the work that has to be done. Other items besides graduate medical education, we still have our healthcare pathways interns with us this summer. They've just gone on a tour of the Rural Sim Center. Rachel Sanchez is meeting with them every week, make sure they're on course. We have 11 of them, and they are interested in nursing and medicine. So that's exciting. We have just become a naloxone distribution program, NDP. Our team, Justin Moore and Sana Garcia, are really just getting out there and sharing naloxone kits with different people in the community. They're very much go-getters, and it's been fun to be able to step into the space and help save lives. Okay, well, I'm going to wrap up. There's more. I know there's more and I'm missing, but that's the update. I should have written it all down. Oh, last night, thanks to Dr. Paul Danuka, the incoming president for North Valley Medical Association, the first committee meeting of the Saving Private Practice group met, and we were really pleased. We had 11 participants. They actually represented the Humboldt Del Norte Medical Society. Our friends up there were able to share our meeting information, and happy to have them join. We had folks from Chico and Redding. We had a variety of different solo small practices represented as well, and all of them passionate about making sure that this type of delivery of healthcare remains in Northern California, because it is an essential delivery mechanism, and that may be vanishing in other parts of the state, but there will be, if we don't continue supporting private practice, some real big holes in accessing care in the North State. And so we're excited. Thank you, Dr. Danuka, for setting that up. So if you're interested, I think the next meeting was set for August 30th. Bridget McBride will have all of that information. But nice to be stepping into, supporting a really good mission for health outcomes in the North State. All right, well, I hope you stay cool, stay hydrated. I have to remind myself all day. I just don't seem to be able to drink enough water. So, and yeah, it's hot out there. So take care. We'll see you soon. Just let me know if you have questions, ideas, things that you might be able to contribute. We are always looking forward to hearing from you. All right, bye.